How to build a successful dental practice. So let's talk about this one item at a time. So just like with any business, with a dental office too, it's very important to be getting new patients and new clients because your patients might be moving away. They move away for college or work, or they simply pass away, or something happens where they're no longer your patients. So you will have some kind of attrition in your practice where you're losing your customer base or part of it. So it's very important that you get new patients, because if your business is not growing, that it's shrinking because of inflation. So you need to be growing at least with inflation plus probably about 2 to 3%. Now, how do you get new patients? In general, there's three categories where you're getting new patients, and it's true with most businesses, most of every business, but it's very true for dental offices. So number one is paid ads. So that would be, for example, Google ads, pay-per-click ads, things like that. Also, being on a preferred provider or PPO plan is part of this, because you're writing off part of your procedure fees. It's not a very good marketing because you're in the PPO list basically with hundreds of other doctors in the area. But for example, Google ads and social media ads can work really well. But this would be basically a new patient flow. Patients won't know you, so they're just coming to you because they're seeing your ads, and you really don't have a relationship with them. And this is where the second part comes in, and this is really, really strong, which is the community-based organic referral. And community means you might be coaching soccer, you might be coaching softball, or you're on a PTO, or you're very involved in your community, and you do all kinds of things, and people really know you. Or maybe your spouse owns a coffee shop. Also, this is organic, so people get to know you because maybe your kids go to the same school district, things like that. So you're getting new patients because people know you in the community. Now, here's a huge category that you can really help yourself by focusing on social media. So for example, if you're not very involved in the community, you don't have a lot of organic referrals for new patients, then you could be extremely involved in social media. You put out maybe one video a day where people get to know you, that you are in the community. They get to know you even though they don't really meet you. And don't underestimate how powerful that is, especially if you make good content and good video content especially. So you can really benefit from this organic content. Matter of fact, some of the most successful practices that I know are very strong in community organic referrals, either involved in a community or they're just simply very, very strong on social media. I happen to be not super involved in the community because we don't live there. We do school visits and scholarships and things like that. So we're relatively involved, but we don't live where the practice is exactly. But I'm very involved on social media, and I post a lot on social media. That's how I bridge this community organic area of new patients referrals. So you can really easily work on this if you're not super involved with the local events by posting on social media. Now, the third one is basically networking, strategic partnership, as well as relationships. For example, you might be referring to medical doctors and they refer new patients to you in return. You can really double dip in these two areas. Like, for example, if you're very involved in social media, very involved in the community, then when a physician refers you a patient, they already know you from here and they got to come to here. And it's the same thing with paid ads. If somebody sees your videos on social media and you post, or they know you from the community, when they see your paid ad, then they're more likely to become a new patient. So this is really, really important to be working on all three of these things. Now, the second big part of building a successful dental practice is convenient hours and locations. And no, you don't have to be working 7 days a week. And no, you don't need $1 million business or building, but you need to be able to have hours that your patients and your customers want. And you need to be in a location where you can actually, patients can actually find you easily and they can park easily. So don't underestimate basically hours and locations. For example, we work 3 days a week, but we have days that our patient base really want, because most of them work in 3 shifts. So we have hours and locations that really works for our patients. So convenient hours and locations is very important. Now, the third thing that's very important for a successful dental practice is what kind of services and procedures do you offer? The more services and procedures you offer, of course, the better your practice will do, because the less new patients you will need and the more income you will be able to generate by offering those procedures. So, and there's a trade-off here. So, for example, the less procedures and services you offer, the more new patients you will need. And oftentimes I see doctors say like, oh, XYZ doctor only does basic dentistry, and he their practice is really growing and doing really well, but what they don't see is that that doctor has a lot of new patients because they're in an underserved area, for example. So they're getting a lot of new patients, so they're doing basic dental procedures, and they do really well because they have a lot of new patients. If you're struggling with new patients, you don't have a lot of new patients, you really need to be offering a lot of procedures, because otherwise your sales, your revenues, and your productions will really suffer. So you can either try to increase your new patients by one of these avenues, or you can increase by the services and procedures that you offer. Now, the fourth category to build a successful dental practice is basically your customers' emotional experience. Again, customers consent to treatment and accept treatment and buy based on emotional experience. If your team or your doctor, they don't provide a good emotional experience to patients, then all these new patients that you're getting and patients that you already have will be leaving the practice, which of course will result in decreased revenues. So it's very important that you focus on the emotional experience of your patients, and that will get them to stay as well as to consent to treatment. So this is really, really important. So what do I see routinely with successful dental practices? What I usually see is that they're very strong in all three of these categories, with paid ads, with community support, as well as social media, as well as they have some kind of networking experience with local professionals, but they're very involved in the community where they get a lot of organic referral, or they're very good on social media to get new patients, and they also have very good budget as well as effective paid ads. They also have very good locations and hours, services and procedures. They offer more services and procedures that are very profitable, and also they have very good customer emotional experience. So this is very important to also work on this, because if customers don't have a very good emotional experience, none of this matters, because your patients will be leaving and not coming back. And this is actually what I see with struggling practices. Oftentimes, struggling practices, the owner kind of paints themselves in the corner because they're not doing these three categories to get new patients. They don't have very effective paid ads. Also, they're not involved on social media. They're not involved in the community. They're not getting organic referrals. This is the biggest part. This is expensive. Paid ads could be very expensive, so some doctors can't even afford it. If you can afford paid ads, you really need to be very strong in these too, because otherwise, where would you get new patients? This is where your new patients are coming from. If you can afford paid ads, then you need to be very strong here. And as soon as you can afford paid ads, I recommend doing that too, because that's where all your new patients will be coming from. And the other thing that I see oftentimes is that doctors really limit themselves on the procedures that they do. They don't have a lot of new patients. They only offer a few procedures, which results in very low revenues as well. And the third thing that I oftentimes see a problem is the emotional experience that your patients have in the practice. That needs to be really good. And once your patients have a good experience in your practice, it's important to also ask for referrals, as well as ask for Google reviews, because patients like to see other patients having a good experience, and people do read those reviews. So if you want to build a very successful dental practice, I recommend working on these four main categories. And then for the new patient flow, I recommend you work on these three main categories, and that will really help you build a successful dental practice. By the way, I'm Dr. Nagy. I offer individual one-on-one coaching and mentoring for doctors to build a successful dental practice with better habits for success and prosperity while they're living their best lives. I teach orthodontics worldwide as well as in US, and I also offer this one-on-one coaching. If you have any questions, my link is in my bio, and hopefully this helped you. Let me know in the comments if you found this useful, and if you identified some of the issues you're having with your practice, and if you're able to start working on it, or you're able to identify it, so now it's a little bit clear what you need to be working from this list.